96.7 FM Pasco, 102.9 FM South Tampa, 970 WFLA, all over Tampa Bay.
Welcome to American Medicine Today. I'm Kimberly Brumell-Bonati alongside Ethan Euchre and world-renowned orthopedic surgeon Dr. Alfred Bonati. So there's a disturbing trend across the country of young people seemingly in great shape, just dropping dead due to stroke or cardiac arrest. But why? The most recent being a 29-year-old professional bodybuilder who had had a stroke while undergoing surgery. Joining us to discuss is returning guest, Dr. Fahmi Farah, a medical expert and board-certified invasive cardiologist based in Texas. Thank you for joining us, Doctor.
Thank you for having me. Always a pleasure to be on your show.
Certainly. So why don't we start with this latest example? This young man, really, by all means, in peak physical shape. He just dies on the operating table. Do we know how this happened? And really, what are your thoughts on it? Because this is so sad.
Very sad story indeed. There are a couple of thoughts that go in this scenario, in this specific scenario, because as you mentioned, he's a young, fit, healthy individual who just died on the table from stroke. Stroke, just to give you an idea, is not very common among 20-year-olds. Usually there's some kind of an inciting event taking place. And in this case, my understanding is that there was some kind of a bleeding event that took place where possible that he lost a lot of blood. And there are two types of strokes. One is an ischemic stroke and the other is a hemorrhagic stroke. So my thought is that if he had a lot of bleeding, he probably had the ischemic stroke where not enough blood flow is going to the brain. So there is oxygen depreciation, and that caused the stroke to happen. That's one way to explain it. And the other cause could have been something called an embolism. So embolism means like either a blood clot or air bubble that could accidentally travel to the brain and cause a massive stroke. Those would be the two most common reasons in this scenario that could be possibly what led to this demise.
How frequently does something like this happen?
Thankfully, not very frequent. Again, in young individuals, the risk of stroke are still not that high, so it's not very common.
And then just obviously we're focusing down on this specific case of a bodybuilder in great shape, but we've seen, and we can even shift away from stroke for a second, we've seen cardiac arrests, we've seen a lot of examples as of late of very fit young people, football players dropping dead on the field. One of the Bills player last season, very famously, that happened on live television. Luckily, he lived. Any thoughts on why this is happening now amongst such a young population that's supposed to be in good health?
Yes, you're absolutely correct. I actually did a couple of interviews on that Damar Hamlin's cardiac arrest, and as you mentioned, thankfully he lived. There are a number of reasons what could lead to something like this. According to latest data, in the last 4 to 5 years, we've seen a striking increase in the rate of heart attack in young population, and that includes the age group between 25 to 43. That's particularly an age group that we ignored in the past because they were considered healthy, and that's not the case anymore. So we are seeing an increased rate of heart attack in young population, so they should not be ignored. But to answer your question specifically, for the young population who can suddenly collapse and have cardiac arrest, there are other conditions other than heart attack. For example, congenital heart disease. There's something called hypertrophic cardiomyopathy. It's a condition where the heart is enlarged, and these people, when they're aggressively, on the field, like doing something like football, which is pretty aggressive, they can go into arrhythmia, like ventricular tachycardia, where the heart just goes into an erratic rhythm and they go into cardiac arrest. So those are some of the common things that run through my mind when I hear something like that.
And what is the recovery rate?
Damar Hamlin's example is a very good example. CPR, how important it is. So if we can provide care in a timely manner, the survival rate can still be very good. Generally speaking, out of hospital cardiac arrests tend to not have a very good prognosis. Less than 1% of the people actually make it. But that all comes down to when they receive that care. So timely care and timely administering CPR is crucial to that survival rate.
And let's shift back to stroke specifically for a moment. I've read that there's a difference between the genders, that strokes tend to affect women more so than men. Is that true? Is that accurate?
To some degree, yes. Women are the other population that was ignored in the world of cardiovascular disease for a very long time. And the recent data and statistics show that that's not at all the case. You brought up a very important question. So we know that blood pressure is one of the leading causes of stroke. And interestingly, a couple of years ago, a study came out that showed that the damaging effect due to hypertension, which is elevated blood pressure, actually happens earlier in women than it does in men. So, it's an interesting concept. So women can, in fact, have more detrimental impact from this, and as a result have higher rate of stroke and cardiovascular disease compared to men.
And also, when it comes to women, don't the symptoms present much differently than men? Much more mild even, where they might not even comprehend that's what's going on, with things like jaw pain and headaches and almost like an anxious anxiety type feel.
You're absolutely correct. When it comes to heart attack, that is true. So I want to distinguish between heart attack and stroke. Okay. Stroke is something that takes place in the brain. Okay. And the symptoms of stroke are very similar to men and women. Okay. And the common symptoms will be drooping of the face on one side, paralysis of one side of the body, or not being able to speak correctly, drooping, or slurred speech, things like that. Whereas heart attack, of course, it has to do with your heart. And you're absolutely correct. Women can have what's called atypical symptoms, where they don't have chest pain at all. They could just have indigestion-like symptoms or just nausea and vomiting. I've had patients who have had back pain when in fact they were having heart attack. I've had patients who had no symptoms other than just fatigue, severe fatigue, and they were having a massive heart attack. So you're correct. We need to pay attention to those atypical signs and symptoms.
And sort of what is the mortality rate for strokes? Because I actually had a really bad experience with a coworker years ago. I won't get into the specifics, but he essentially suffered a stroke live on the air. He was older, probably in his early 70s, but he was talking and just all of a sudden was incoherent and mumbling, and it was scary to watch, but he ended up being fine afterwards. And then also my own grandmother had one. It seems like the recovery rate is pretty good. It's not that deadly. Is that the case?
It all depends on how big that stroke is and how quickly we receive treatment, and also the two different types of strokes that I mentioned. If it's a hemorrhagic stroke, they tend to be more deadly, whereas ischemic stroke, again, the difference is that a hemorrhagic stroke, you're bleeding into your brain, and ischemic stroke is where there's a clot or blockage somewhere in the blood flow, and that just gets blocked, so you're not getting enough blood flow to the brain, and as a result, there's less oxygen. So the ischemic stroke, if it's not large enough, then yes, the survival rate is pretty good. But if it's a massive stroke, it can still be pretty deadly, especially if treatment is not received in a timely manner.
Is there anything that people can do? Say they're home alone, right? Everyone went to work, maybe they stay at the house or they're out and about. Is there anything they can do that might slow the progression so they can seek help?
Yes, in the acute setting, if you have these signs and symptoms, the best thing to do is to call 911. My advice is to not try to drive yourself to the hospital, just because you don't know what the outcome is going to be between you trying to drive. You may have a cardiac arrest or you may pass out. So the first advice is to call 911 and wait for help. The second thing is prevention. Prevention is key. As we know, 80% of cardiovascular disease is actually preventable. So what causes the major leading causes of stroke are, again, smoking, high blood pressure, high cholesterol, diabetes. These are the very top numbers, that causes this condition. So making sure that you're taking your blood pressure medication, that you're seeking help and seeing your doctors in a regular manner, those are all important things to do.
Thank you so much for being on the program and sharing these symptoms so people can be more apt to recognize them when they happen. Dr. Fahmi Farah, a medical expert and board-certified invasive cardiologist based in Texas, and one of our favorite returning guests. Thank you for being on the show.
Thanks, Doc.
Thank you. Always a pleasure to be here.